who is a woman with a disability. She's also the mother of 3 children and a member of the Lira District Disabled Women's Association in Uganda, which is a partner organization of Humanity and Inclusion's Making It Work project. This project supports women's rights and disabled women's organizations in their work on advocacy and fighting against gender-based violence. Welcome, Janet. Could you share with us some examples of violations of sexual and reproductive rights at healthcare level that women and girls with disabilities face in your context and from your experience?
Thanks, Anne.
Yes.
First, some girls and women with disabilities are subjected to forced contraception. The relatives of girls and women with intellectual disabilities, in particular, take them to the health center to get injected with contraceptive without informing them what is going to happen and without getting their consent. And this happened mostly in the private facilities. Also in the same private facilities as well, girls with disabilities around 16 and above are sterilized without getting their consent or even being explained about it. Due to the cost of the procedure, this is happening mostly in the urban areas and in families who can pay for the surgery. Last, in some facilities, some health professionals, some nurses still have negative attitudes towards women, pregnant women with disabilities, blaming them and so on. It is making the mother really fear to get to the health facility. This brings negative impact for the health of the mother and the baby to come, as they will not attend antenatal care. Thank you.
Thank you, Janet. And could you share a couple of actions undertaken by LIDWA, your organization, that have been decreasing or successful in decreasing the SRHR violations of women and girls with disabilities?
LIDWA is continuously raising awareness about SRH for women and girls with disabilities to the government and the women themselves to remove misconception, stigma, and discrimination. This is targeting the community at large, the local government, and the women themselves. As well, we are engaging with local leadership. The district health office has come out with some measures to allow better access to women with disabilities to health services, including reproductive health. And this is also for survivors of gender-based violence. LIDWA has been establishing GBV committees at the community level, and we also have focal points in each parish of the sub-counties where we work. These focal points are women with disabilities themselves. The committees support effective referral pathways for GBV survivors and can report problems. Last, LIDWA has been training the health sectors in the issues of gender-based violence, GBV management, others. We have been discussing with them around the different types of disabilities and also the issues around the consent and the rights of women with disabilities. Thank you.
Thank you very much, Janet. And it's so important as we understand both the more academic or the data related evidence that allows us to understand the heightened risk to sexual reproductive health and rights violations that face women with disabilities. And then you, Janet, giving us some really clear examples from Uganda and from the work of your organization. I'd like to continue